Summary. Legal definitions of sexual assault specify those forms of sexual aggression that constitute criminal offenses, such as rape, attempted rape, and sexual coercion. Research definitions cover a wider range of coercive strategies and sexual acts, including non-criminal forms of sexual aggression, such as verbal pressure. In everyday discourse, sexual assault is defined primarily in terms of the real rape stereotype, characterizing rape as an attack by a stranger who uses physical violence to force the victim to engage in sexual acts. Prevalent studies demonstrate the widespread occurrence of sexual assault. Crime statistics, reflecting only cases reported to the police, seriously underrepresent the true scale of sexual victimization, as evidenced by the much higher prevalence rates obtained in victimization surveys and research studies. The majority of sexual assaults are committed by perpetrators known to the victims, such as acquaintances, dates, or intimate partners, contradicting the real rape stereotype that designates stranger rape as the prototypical form of sexual assault. One group of explanations of sexual aggression refers to macro-level processes, such as the evolution of sexual aggression as a strategy for enhancing male reproductive fitness, or socio-cultural patterns of male-female power relationships. A second group concentrates on micro-level risk factors, most notably in the individual perpetrator. Sexual aggressors have been found to differ from non-aggressors in terms of sexual arousal patterns, rape supportive attitudes, childhood experience of abuse, and risky patterns of sexual as well as drinking behavior. Highlighting that the responsibility for sexual aggression lies with the aggressor, research has identified factors associated with an increased vulnerability to sexual victimization. High levels of sexual activity, alcohol consumption in the context of sexual encounters, and the ambiguous communication of sexual intentions have been shown to be behavioral vulnerability factors for sexual victimization. In addition, there is consistent evidence that childhood experiences of sexual abuse are linked to an increased risk of subsequent revictimization. Sexual victimization has a profound negative impact on victims' psychological well-being and mental health. The rate of post-traumatic stress disorder, PTSD, is high in victims of sexual assault. Victims who blame themselves for being assaulted have greater problems in coping with the assault. Moreover, responses by others to the disclosure of the assault often reflect the attribution of blame to the victim, and derogatory attitudes toward victims of rape held by laypersons, police, and legal professionals have been shown to be experienced as a second assault. Women also commit sexually aggressive behavior towards men, albeit with lower prevalence rates. Risk factors for female perpetration and male victimization are similar to those found for male perpetrators and female victims. Even though some evidence shows that men rate their victimization experiences as less distressing than do women, this does not necessarily mean they are less affected. For men to accept that they have been sexually victimized by a woman is a threat to their self-esteem, undermining their sense of masculinity.